Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. Today, we'll be talking about the Centers for Medicare and Medicaid's update on nurse aide training requirements. And in a minute, I will be including a link to that guidance in the chat. Everyone will be on mute. But if you have any questions, please enter them into the chat and we will address them at the end of this webinar. We encourage you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, we'll be talking about CMS's 5-star quality rating system for nursing homes. My name is Kathy Caudill and I'm a communications specialist with Quality Insights. And now I would like to introduce our guest today, Penny Imes. Penny is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. She found the perfect combination for herself at Quality Insights, where she is able to work in quality improvement with long-term care nursing homes. So Penny, welcome and thank you for joining us today to talk about the CMS waivers and the transition from TNAs to CNAs.
Thanks, Kathy. I'm glad to be here today.
All right. So can you give us some background on the emergency waivers that were put in place by CMS?
Yes. In response to COVID, CMS enacted some temporary emergency declaration blanket waivers. And what they were meant was to provide healthcare providers with extra flexibility so that they would be able to respond to the COVID-19 pandemic. So some of these, there were restrictions on resident group in-person meetings, physician visits and how they delegated tasks. Certain requirements around QIN-QIO programs were limited. They also limited some quarterly fire drills that would have required mass movement of staff and residents. There were some lessening of nurse aide in-service training requirements, and then also the training requirements to become a certified nursing assistant, just to name a few.
Yeah, and I just put that guidance in the chat if anyone wants to be able to open that just to have it for reference. Next question, why has CMS decided to end these waivers now?
Well, the waivers of some of those regulatory requirements, they did provide that flexibility and for nursing homes to be able to operate during the pandemic. They also removed some minimum standards of quality that did help ensure residents' health and safety were protected. Some recent findings from on-site surveys have revealed significant concerns with resident care that were not related to infection control. So, for example, abuse, weight loss, pressure ulcers. And CMS has had concerns that waiving certain regulatory requirements may have contributed to these outcomes and raised the risk of other issues. For example, when they waived the requirement for training, some nurse aides and paid feeding assistants may not have received the necessary training to help identify and prevent weight loss. There's really no way for CMS to know that on a global scale. And likewise, they waived those requirements for physicians and practitioners to perform in-person assessments, which may have prevented some individuals from being able to really accurately assess a resident's clinical needs, which could, and then in turn, contribute to depression or pressure ulcers. And then also the waiver of certain life safety code requirements, specifically when I talked about, not having to do the quarterly fire drills with a mass exodus. Some nursing homes may not have had their fire prevention systems inspected to make sure that they were operating effectively to prevent fire. So just loosening some of those requirements. CMS became concerned that maybe residents' health and safety had been impacted by those waivers. And also the waivers have been in place for a much longer time than they originally thought they would be, based on the fact that COVID just kept coming back. And of course, the memo that you did put into the chat that includes all of these removal of emergency waivers. I do want to encourage everybody listening to make sure that you do pull out that memo and take a look at it. Because within the memo, for some, we're going to talk about some very specific waivers, but there are other waivers in there that do affect nursing homes and nursing home staff. And you really want to review the memo and pay attention to what those 30-day and 60-day timeframes were for the waivers. Now, today we're going to be talking more specifically about the nurse aide training requirements waiver, and that's the one that covers that transition of the temporary nurse aide position into a certified nurse aide.
Yeah. And can you review the nurse aide training requirements that were in place prior to the pandemic?
Yeah, pre-COVID, in order to become a certified nursing assistant in a long-term care facility, an individual did need to be a graduate of a state-approved nurse aide training program. So those minimum requirements for those state-approved programs needed to be at least 80 hours, with at least 37.5 of those hours devoted to a supervised clinical experience. So this then made the individual eligible to take the state nurse aide competency exam. And nurse aide trainees had 2 years after completing their nurse aide training to take that state exam. However, once a trainee would start working for an employer, they had 120 days to complete the competency exam. And one thing that sometimes comes up with that I want to address right now is some people ask, well, what would happen if during those initial 2 years that person changed employment? And in those situations, the 120 days would start over for the person, but ultimately it's that 2-year time period that remains unchanged. So 2 years from completion of their training till when they have to take the competency exam is something that hasn't changed. And then they still have 3 attempts to pass each test because there's a written and a skills evaluation. And I do want to note before we move on to talk about the TNA to CNA today, as a side note, just for Pennsylvania nursing homes especially, the testing site for Pennsylvania is no longer the Pearson VUE, it's now Credentia. I'm sure our audience knows that, but I just want to make sure I say that.
Yeah. What training do TNAs need to become CNAs?
Well, per the CMS QSO, those temporary nurse aides, so TNA temporary nurse aides, who were hired during the blanket waiver period, have to complete that state-approved nurse aide training and competency evaluation program to become a certified nurse aide. And for both Pennsylvania or West Virginia, if your state has approved a transition or bridge program from TNA to CNA, you can follow that state-approved program.
Okay. We've heard that some states have backlogs for training and/or testing. What can facilities do if backlogs are delaying their TNAs from becoming CNAs?
Yes, and my understanding is that there could have been some delay in being able to take that exam already prior to this. And now when you think about all the thousands of nursing homes that are trying to get their staff in to have the testing done, there's very likely that there might be a backlog. And CMS does acknowledge that there could be instances where that volume of temporary nurse aides who have to complete that program might exceed the available state capacity. So there are ideas that have been shared for states where backlogs and delays for training and testing may exist. For one thing, you want to make sure in the nursing home, for the nursing home staff, that you're evaluating the status of all your temporary nurse aides that you have employed, including their progress towards becoming certified as a nurse aide. And you want to maintain supporting documentation for their progress. So make sure that you're following up with them. Have written documentation that demonstrates all attempts that they have made to complete their training and testing. And this can include documentation from both the facility and the temporary nurse aide to training programs and testing sites in multiple locations. And then within your facility, you want to make sure that you're having frequent communication with state officials. Now that can be CNA registry, survey agency, Board of Nursing, Department of Education, but you want to make sure that the lines of communication are open regarding any delays and backlogs in training or testing that you're identifying, and also outline the facility's attempts to enroll their TNAs into training or testing programs. And again, document those communications. And I don't think anyone in nursing is surprised to hear me keep talking about document, document, document. And this is one other case where we need to do that. And also, you want to make sure that you are enrolling your temporary nurse aides into training or testing centers as soon as possible. Even if the only option is a wait list, get them on that wait list. And then again, keep all communications to and from any state agency overseeing a nurse aide program. Maintain a log that is showing your ongoing and multiple attempts. And as I said, keep communications also from the training and or testing centers. You want to maintain a log that's showing all your attempts from them also to get the testing done. Now, I do believe that the American Healthcare Association is in the process of developing a template for facilities to use that will guide the process of notification, asking to retain the waiver. So I would encourage everyone to watch for updates for when that template might be completed. But again, I can't state enough, your own documentation and keeping a log on the progression of how everyone is doing with the training, with the testing, with their attempts is just extremely important.
What should a facility do if the state does not have backlogs, but it does have TNAs working there?
Well, and if your state, and some of you in the audience probably know a little bit more if you've attempted to do anything in Pennsylvania, but if we don't have a current backlog or delay in training or testing, you should then be actively seeking to transition those temporary nurse aides into certified nursing aides as soon as possible. And as I said previously, you want to make sure that you're maintaining documentation for each of them to show their progress towards becoming certified so that you can ensure it's timely according to the timeframes.
And speaking of timeframes, how long can TNAs still work as nurse aides in training after the waiver ends?
Well, the waiver is set to end on June 6, 2022. So we have a month. The traditional 4-month time per CMS requirement to get nurse aides into the training to become certified will begin on June 6, 2022. So facilities really want to make sure that their TNAs become certified before October 6th of 2022 to continue working as a nurse aide. If a temporary nurse aide is not certified by the end of the 4-month post-waiver termination, they most likely will not be able to continue working as a nurse aide in training, except for those who are experiencing testing and or training capacity issues and have received approval from their state official. So that's why that documentation and that communication is extremely important.
What should a facility do if it has TNAs that either do not want to become CNAs or are unable to do so within those timeframes?
Yeah, there are probably some temporary nurse aides who while they may like working in long-term care, their goal is not to become certified. So if you do have TNAs who either don't want to transition into a certified nursing position, or they can't get transitioned within the allowed timeframes, but they have received approval, then you want to consider what what else could you do with them? How could you engage them maybe in non-nurse aid work? And some nursing homes, and it's going to depend on your nursing home, there could be a valet, a hall monitor, shift coach, answer call lights, spend time with residents one-on-one to provide stimulating activities, or any other number of tasks that we know happen within our facilities that would not require certification.
Okay. Do you have any other closing remarks before we move on to the Q&A?
Yeah, one thing that I do want to make sure that everyone remembers is that while some of those waivers are being removed, CMS is still concerned about the risk that COVID poses to nursing home residents. And they would like providers to continue to make sure that you're implementing those actions that reduce the likelihood of COVID-19 transmission and still follow all those existing requirements. And for example, we know that vaccines are still the strongest tool that we have to protect the health and safety of our residents and staff. So facilities should use all their available resources to support the residents and staff in getting vaccinated, continue educating residents and staff regarding the benefits and potential side effects with the COVID-19 vaccines, and then offering the vaccine on a routine basis.
All right, so we're getting ready to move on to the Q&A. I did have a question about sending out a recording of this webinar. We put it on our YouTube channel, which I'm about to pull up the link to that, and I'm going to drop that in here. And usually we'll get the recording up by tomorrow. And then we also include it in our newsletter. It's called the Last Minute Lowdown, which goes out Fridays. If you don't think you get that newsletter, you could send us your email in the chat and we will put you on the newsletter. And the recording for these webinars is always at the very end of that newsletter. And we also upload it in a podcast format in case you just want to listen to it and not watch our faces on the YouTube. All right, so if you have any questions, please drop them into the chat. And I'm going to just do a quick wrap up real quick before we move on to the Q&A. Okay, so again, I'd like to remind everyone about next week's webinar. It's going to be about CMS's 5-star rating system for nursing homes. So that will be the same time next week, Wednesday at 2 p.m. We also host office hours live chats twice a week. So if you are looking for one-on-one advice for your facility, you can just pop in during our office hours and shoot us a message and someone will be there to answer your questions. And those are every Tuesday at 8 a.m. and every Thursday at 2 p.m. And you can find the links to those live chats and our webinars in the Last Minute Lowdown newsletter that I was just mentioning. It goes out each Friday. And again, if you don't think you get that newsletter, just drop your email into the chat and we will put you on it. And now I'll look real quick to see if you have any questions. And you can also ask any questions about the other waivers that are being rolled back, not just this particular one that we decided to discuss today. Looks like Deborah dropped the link in the chat too for PA Nurse Aide Handbook Facts. So that's useful if you're based in Pennsylvania. Check out that link that Deborah dropped in the chat. Well, actually, Deborah, that showed up, I think, just in the chat that the hosts can see. So I'm going to put it in again.
Yeah, it's a link that, and it's a great idea, Deb, thanks. The link to the PA Nurse Aide Handbook, frequently asked questions from Credentia. So that will be something that, there we go.
Yeah.
And something that I think would be very helpful for you. Also, there's these waivers were lifted, but I know with the temporary nurse aid, there's still a lot of conversations going on from state associations and organizations. So again, our Last Minute Lowdown, our newsletter, these webinars, we will make sure that we're updated on any new information that comes up related to any of this, and we'll make sure that we keep all of you updated on that also. So keep joining our webinars and checking out our newsletter, because we keep you updated with the latest information, as Kathy said.
Yeah, the latest with Medicare and CDC and NHSN and just some general health news. And we also include the latest health news for Pennsylvania and West Virginia. If there's free webinars or grants or other resources, we include those too. So it's just a nice little roundup. And I'm trying to get the link now to our YouTube. It's almost coming up, but my internet is going a little slow. All right, here's the link to our YouTube channel. So we upload the webinars in there every week too. So you can go back and watch some previous ones if you would like to. All right, so I don't think I see any questions relating to the topic. Got some emails, we've got some resources that we dropped into the chat, and I don't see anything in the Q&A, so I think we're good to go ahead and wrap up.
I'd just like to thank everyone for coming today.
Yeah. All right, so to wrap up, I'll give Penny's contact information in case anyone wants to reach out to you directly. So Penny's phone number is 1-800-642-8686 with the extension 7636. And you can email her at pimes@qualityinsights.org. And you can check out our other interviews by visiting qualityinsights.org/QIN_vlogs and pods. That's qualityinsights.org/QIN_VLOGSNPODS. Penny, thank you for joining us today. And I would like to thank all of you for joining us too. I see some emails in the chat and I will be getting those. And thank all of you for coming.
Thank you. Bye.
Bye.